Hi guys, my name is Kayla Cotton and I am currently an MSW graduate student at the University of North Carolina at Charlotte, and I'm going to be talking today about an evaluation plan for Spark Network. Spark Network is the agency that I've been doing my field placement with this last year, so I'll just be talking about a little bit about what an evaluation of this agency and about one of their programs could look like. So let's talk a little bit about why Spark Network was created. 1 in 5 youth, ages 13 through 18, experiences a mental disorder. This can lead to hospitalization, which is very costly not only for the families of the adolescents, but also for society in general. It can also be really damaging due to the social stigma that's attached to mental health related hospitalizations. There are not enough clinicians trained to provide community-based services, which is what's needed in order to keep adolescents out of higher level of care such as hospitalizations. Spark Network offers a variety of services, but the program that's going to be the focus of this evaluation is the In-Home Therapy Services Team, or IHTS. This program provides 2 hours of clinical and case management services weekly, so every client is paired with a clinician as well as a qualified professional who acts as a case manager, and together they will provide 2 hours of services for each client every week. In order to be eligible for this service, you have to be receiving services before the age of 18. You must have an Access 1 diagnosis, and you must display major disruptions in at least 2 domains. So these domains can be home, school, contact with the Juvenile Justice Department, any organization that's based in the community, such as a church or a sports group, anything like that. So if a child or an adolescent is experiencing major disruptions in 2 of those areas, then they could potentially qualify for this service. So because Spark Network is only a couple years old, they have not had an external evaluator come in and do any previous evaluation of any of the programs or the agency in general. They do compile a list of their outcomes data, which is collected at discharge for each client, and they do release that information yearly, but again, they have not had any formal or external evaluations conducted. Goals of the IHTS program is to stabilize clients' thoughts, feelings, and behaviors. So this really looks like a decrease in problematic symptoms. So the goal is really to get clients to a point where they're feeling more stable in their environment. Another goal is to decrease community disruptions, again, because this is a community-based service and all services are provided in the home. The clinicians and the agency really want to focus on decreasing disruptions. The final goal and really the overall goal of the program is to decrease the number of clients who are referred to costly higher levels of care. Again, hospitalization and group homes, anything like that can really be costly for families as well as society, and can be really intrusive level of care that only needs to be used for a certain select number of adolescents. So the goal really here is to provide services in the least restrictive environment for adolescents if possible. So the stakeholders for this evaluation are going to be the Spark Network leadership team, and that includes the CEO, the CFO, as well as the founder and owner of the company. Most importantly and most involved in this evaluation is going to be Preston Cole, who is the supervisor of the IHTS team. He's the clinical supervisor of the team. He has been my field instructor for this past year, so he's the one who has been providing most of the information that's used in this evaluation plan. So along with the leadership team, the IHTS team clinicians as well as the IHTS qualified professionals will be included, as well as clients and families who have been recipients of the services that have been provided through Spark Network. So scoring will be implemented throughout the evaluation. For starting with strengths, Whenever any need for any specific client or for the agency is discussed, a strengths-based approach will be used. Especially because this is a community-based service, respect and consideration of culture in any decision-making is going to be really important in the evaluation process as well as within the clinical field. As far as resources go, the leadership team will be in charge of making sure that the evaluation is conducted within the allotted resources, and making sure that the evaluation is something that is feasible for the agency. As far as ethics go, of course, at all time, client confidentiality will be maintained and professional ethical standards will be upheld by all members of the evaluation team. As far as agreement goes, Spark Network currently operates under a unanimous approach to any sort of decision making, which means it's not a top-down approach made by the leadership team. It is everyone coming to an agreement. So that approach will be maintained throughout the evaluation, and that includes every member of the evaluation team and all stakeholders. And lastly, this evaluation will be conducted across multiple systems because all clients receiving services for the time of the evaluation will be included in the evaluation. So the next part is the logic model. So talking about the logic model here, just to review some of what Spark Network looks like and what the services are that they provide. So Spark Network is comprised of clinically licensed therapists who use evidence-based practices. Specifically for our agency is solution-focused therapy, motivational interviewing, cognitive behavioral therapy. They work really closely with qualified professionals who again take on that case management role, who also work really closely with clients and families, and all funding for the agency again comes through Medicaid. So our clinically licensed therapists work using these evidence-based practices to provide targeted interventions to clients and families based on whatever personalized care plan is developed during the intake process. The qualified professionals provide linkage to community services to help families with outside support. And then finally, the clinically licensed therapists do advocate for clients and families across those domains that we discussed earlier, such as school, home, juvenile justice system, and any community-based activity. So as a result of the program at discharge, the goal is for clients to step down to outpatient therapy, and for clients and families to make sure that they're connected with community-based services or supports to support their individual needs. As a result of this, we're really looking to decrease the number of negative thoughts, feelings, and behavior, as well as those community-based disruptions, which hopefully, again, will lead to an overall decrease in adolescents referred to a higher level of care by Spark Network. So this evaluation is answering three questions. So the first question is, do clients and families report a stabilization in their thoughts, feelings, and behaviors as a result of the program? Again, when we say stabilization, we're really looking for a decrease in problematic or negative symptoms that clients may be experiencing. So in order to assess this will be a quasi-experimental pre-test, post-test design, which the data will be collected during the intake and discharge process. So currently, every client who is a service recipient of Spark Network goes through the intake and discharge process. So during this time, a questionnaire will be filled out at intake with a qualified professional who completes the intake, which really focuses on what sort of negative symptoms the client's experiencing. And then the same questionnaire is going to be used at discharge, so they will be able to see if there has been a decrease in the negative symptoms that the client is experiencing. So the test that's going to be run for this, the data analysis, is going to be a t-test for G-dependent samples, again, to look at the relationship between the program and the decrease in these negative feelings, thoughts, and behaviors or problematic symptoms. The sample size for this is all clients served during the evaluation window. Again, because this is going to be a part of the normal intake and discharge process, every client who is going to be served by Spark Network during the evaluation window will be a part of this. So the evaluation question is, do clients and families report a decrease in community-based disruptions as a result of the program? Again, this will be, data will be collected, and the test that will be, the experimental design that will be used is a quasi-experimental pre-test, post-test design, again at the intake and discharge process. So they'll be looking at different types of community-based disruptions and seeing if the client experiences these, again hoping for a decrease by the time of discharge. Again, a t-test for dependent samples will be run to be looking at a relationship between the program and if there is a decrease in community-based disruptions. And then again, just like question number 1, all clients served during the evaluation window will be a part of the sample. Again, because this is going to be part of the normal intake and discharge process for Spark Network's IHTS team. The third evaluation question that the evaluation is aiming to address is there a decrease in the number of adolescents referred to a higher level of care as a result of the program? So this is going to be a quantitative data analysis, and because Spark Network has been collecting this data for the 3 years that it's been in operation currently, there are multiple data points, which is why we're going to use a linear regression to look at this this data and to see if there is a relationship between, see if there's been a decrease in the number of adolescents referred to a higher level of care by Spark Network. So again, all of the clients who have come through Spark Network IHTS team in the last 3 years have had discharge data collected, and so that continuing on with the next 2 years, which will be the timeline of the evaluation, will be all clients served within the last 5 years. So the sample size is every client that's come through the IHTS program at Spark Network for the last 5 years. As far as interpretation and dissemination goes, the evaluator will be interpreting the results as an unbiased party, just to make sure that, again, that this is held to a completely ethical standard and an unbiased standard. The evaluator will do all the interpreting, and they will present this to the IHTS supervisor, which again is Preston Cole. All stakeholders are going to meet back together with Preston and the evaluator really facilitating this meeting to discuss the strengths of the evaluation as well as the areas for growth as directed by the data. So they'll look over what the agency has done really well and areas that the agency can improve on. Once this has been discussed by the evaluation team, then the agency is going to release this evaluation report to the community, including the MCO that currently works with Spark Network, which is Cardinal Innovations, as well as any future client. They'll receive also a consumable report about the agency, which hopefully will be discussing the progress that Spark Network has made and the decrease in community disruptions, as well as stabilization in thoughts, feelings, and behaviors, and the decrease in clients referred to higher levels of care. So the budget for this evaluation, there is going to be some time needed during the planning process, and so again, that time costs money. So the Preston Cole, the program manager, along with the members of the IHTS team, will meet with the external evaluator to really come up with what goals they want to address, how they want to address these goals, and come up with the questionnaire that will be used at the intake and the discharge process. Stakeholder engagement will be used to really get clients and families on board. So all of the evaluation team and all the stakeholders will meet together to really discuss the evaluation at length. As far as data collection goes, not a lot of funds are allocated to this area just because the intake and discharge process are part of what's already happening during normal operations of Spark Network, which means that the qualified professionals and the clinicians that are currently completing these processes are not going to be doing much different other than giving an additional questionnaire to clients and families for the 2 first two evaluation questions. Outcome data as far as referral rates for higher level of care is something that's already being monitored by Spark Network. So the only thing that's going to be budgeted in here is for Preston. Once all this data is collected, or as the data is being collected, the qualified professionals and the clinicians are going to send this data on to Preston, who is going to have to compile all of this data for the evaluator. As far as the data analysis goes, the evaluator will be doing all of the data analysis. Because Preston is going to compile this data, it should not be an extensive data analysis that needs to be run for these data sets. Once the data analysis is complete, the report preparation will be completed by the evaluator again, who will come up with consumables that can be given to every stakeholder at the meeting, as well as things that can be presented to the community. And finally, the follow-up meeting will have every stakeholder there, as well as the external evaluator who will be facilitating the meeting to discuss the results of the evaluation. We're looking at a 16-month timeline. So at the end of this year, at the end of 2019, is when we'd like to start the evaluation planning. So doing that would be a month of evaluation planning and then a month of stakeholder meetings, just to get everybody on board before the data begins to be collected. So starting in January 2020 is when we really start collecting this data, and we collect this data from January all the way through December at intake and discharge process. Then there will be a month for data analysis, which would be January of 2021, and then finally wrapping up the evaluation with the report preparation taking about 2 weeks, and then the follow-up meetings taking about 2 weeks. So all in all, we're looking at a 16-month evaluation, with really the big core chunk of time being for the data collection for the year for Spark Network. Because Spark already is collecting data for outcome data on a yearly basis, we really want to make sure that the data collection that we're doing now fits with the yearly outcome data that's already been used and already been analyzed from previous years. So I hope that that helps a little bit about the evaluation that we're looking to conduct on Spark Network. Thank you so much for your time.